brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Do you know what the largest organ of your body is? All organs aren't necessarily inside your body. It's your skin. And if you didn't know that, it's okay. Neither did I until I did my research on tonight's topic. It's been a while since my basic biology class. Anyways, in terms of both weight and surface area, skin is the largest organ, separating the inside of your body from the outside world. It protects, it helps us sense, and it regulates our body temperature. But there are many conditions that can irritate, clog, or inflame your skin. Here to tell us more about dermatological diseases is Express Care's Dr. Jitka Lom. So actually, we were talking before the show, so now the newest thing, actually, the largest organ is now fat.
Fat.
So things have changed since research, right?
Yeah.
But normally it's the skin.
Yeah.
All right, so what are some of the most common types of dermatological diseases?
Okay, well, the ones that we commonly see are acne, psoriasis, eczema, and then skin infections such as sores and boils.
Okay, and so when you talk about eczema, what are the different types of eczema? I know a lot of people on Guam suffer from that. Is it because of, is it hereditary? Is it the heat? Is it all kinds of contributing factors?
It's so many things, yeah. The word eczema means itchy, dry, sensitive skin. So if you think about it, okay, it's itchy, it's dry, and it's sensitive to the environment or to certain foods possibly that you're eating. The main problem with eczema is that people's skin is actually physically thinner than a healthy person's, other person without eczema. So the child with eczema has much thinner skin, the barrier is much thinner, and it's easier for things to get inside. Plus it tends to be dry and it'll crack a little bit, so chemicals and foreign substances can get inside and cause inflammation. That's the main problem. So as far as forms of eczema, we have plain old, childhood eczema that's also associated with asthma and with allergies. And then we have a form of eczema called contact dermatitis, which is a sensitivity to chemicals. And this is very common, for example, when people wash their hands with harsh detergents or use strong perfumes or other chemicals at their workplace. They may get a form of eczema, especially on their hands, from the exposure to chemicals. And then we have something that's very common in older people called nummular eczema, and that eczema is coin-shaped. The word nummular means coin-shaped, and it's kind of round, and it's often mistaken for a ringworm because it will affect sort of like the drier parts of the lower legs or sometimes on the arms, and it's kind of round and coin-shaped. Again, a dry skin condition.
Okay, so what can people do to treat those? Is there like one cure-all?
The one most important thing is to remember that your skin is dry and it must be moisturized. And when we talk about moisturizing, we're talking about using greasy substances, the greasier the better, to create a thicker skin, remembering that you have slightly thinner skin than other people. So we use Vaseline, petroleum jelly, ointments such as Aquaphor or Eucerin, these are common names, or even just coconut oil to lubricate the skin to keep it nice and smooth so that other foreign substances don't get in. That's your most important thing in eczema. You can also use medication and all that stuff, but until you really start hydrating and moisturizing, all those other things will not be as effective. And when we say how much, many times a day, 4 or 5, 6 times a day, continuously moisturizing.
Okay, and then I know a lot of people, when they get into the heat, they're kids.
Yes.
So how do you combat that?
So yeah, well, that is very challenging on Guam because, of course, it's hot. But if possible, at least changing the clothing when it gets sweaty so that the clothing at least is dry. Again, moisturizing as much as you can, and then, if possible, staying cool, staying in the shade or indoors.
Okay, moving on to another topic. You mentioned about psoriasis. Now, what are the symptoms of that as opposed to eczema?
Right, and sometimes they can look a little similar. Well, psoriasis is, again, a dry skin condition. It's itchy, dry skin, though, that comes in plaques. With eczema, it may affect large portions of the skin. With psoriasis, it's a discrete plaque, meaning like you can sort of draw a ring right around it, okay? And it's very thick and crusty and flaky, and it can affect people's scalp as well, or behind the ears, their belly button. It can affect their fingernails too, where they'll have damaged looking nails that are yellowish and raised, and they may also get psoriatic arthritis. So about 15% of people with psoriasis will also have arthritis in their joints.
Okay,
yeah.
And so what can you do, or what are the symptoms?
And with psoriasis, that's an internal condition. Basically, it's not really related to anything on the outside, what you eat, what you touch, what chemicals you're using. It's an immune system condition where the skin is making a mistake. It's flaking too quickly in certain areas. And what can you do? There are many medications that we can use to control psoriasis. Unfortunately, it can't be cured. And again, because it's a dry skin condition, moisturizing is incredibly important.
Okay, and one last disease before we go, or one issue, is also boils. And
Yes.
I think on Guam, I've heard of many people that have had this problem. How do you get them? Is it because of poor hygiene, or can it be other things, and what can you do for them?
Thank you. Well, boils are infections. They're caused by a bacteria called staph. That's short for Staphylococcus. And it's very common on Guam because it's a tropical island, and lots of people carry staph around actually in their noses. And this is a bacteria that people inhale, then it sits on their little tiny nose hairs, and then they'll go like this. Now it's on their finger. Pretty soon they scratch a mosquito bite, and now it's infected. So it's not from necessarily eating mayonnaise or greasy foods, or as people talk about on Guam. It is related to your overall health condition and your hygiene. So you need to use warm water with soap to wash your body. Not everybody on Guam has warm water. And when you're using your warm water and soap to wash your body, also wash inside your nose, and use a little Q-tip with some soap, wash inside your nose. You can even use a little antibiotic ointment to clean up in there to get rid of the staph bacteria on your body. You can even buy something called HibaCleanse, which is an over-the-counter sort of body wash. It's pink and it's not expensive. You can buy it at a pharmacy, and you can use that to kill germs and clean them off your body if you go to the gym a lot or you're involved with sports and so on. And the key is to eliminate staph from your environment so it doesn't get into your pores or into a sore and cause an abscess, which is a boil. Now, if you do get a boil, please do not squeeze the boil, okay? Because when you bust that thing, you just spread those bacteria all over the rest of your skin, and you're going to get more, plus you'll spread it to other people. So when you get a boil, remember, okay, this is an infection. You're going to put hot compresses on it, warm wet towels, put heat on it. You can also put the crushed hibiscus, like a lot of people do on Guam. They put a crushed hibiscus flower on that to try to draw some of that heat out of it. And then if it's not going away, then you may need antibiotics. But oftentimes when we see people with boils, it's the first sign that they have diabetes. We see that a lot in the clinic. So it's your underlying condition as well.
All right. Well, we will pick up this topic when Healthy Living returns. Stay with us.